Why is fifth disease usually mild for children? Imagine catching a common cold that mostly just makes you feel a little tired or have a slight runny nose. That's similar to what happens with fifth disease in most children. The reason it's usually mild comes down to how the virus interacts with the child's immune system and body. Fifth disease is caused by a virus called parvovirus B19. In healthy children, this virus tends to cause only small, temporary effects because their immune systems are strong and can fight it off effectively. The virus mainly targets cells in the bone marrow that make red blood cells, but in children with normal immune systems, this only causes a brief slowdown in red blood cell production, which isn't usually serious. When children first get infected, they often have just mild symptoms like a low fever, headache, or a runny nose. Some children might not even show any symptoms before the telltale rash appears. This rash usually shows up about 4 to 14 days after infection and looks like bright red cheeks, giving it the nickname slapped cheek rash. The rash is a sign that the immune system is actively responding to the virus. It lasts only a few days on the face but can spread to other parts of the body in a lacy pattern for up to a few weeks. Interestingly, by the time the rash appears, children are no longer contagious because their immune system has gained control over the virus. Most children recover fully without needing special treatment because their immune systems are capable of managing the infection. The virus's effect on red blood cell production is temporary and usually not enough to cause serious problems. Some children might experience mild joint pain or swelling, but this usually goes away on its own. The overall picture is that in healthy children, fifth disease is a mild illness that resolves on its own within a few weeks. However, in children with certain blood conditions like sickle cell disease or hemolytic anemia, or in those with weakened immune systems, the disease can be more serious. Their bodies struggle more to control the virus, which can lead to complications like anemia or joint problems. These cases highlight how a healthy immune system is key to keeping fifth disease mild and manageable. In summary, fifth disease is usually mild for children because their immune systems can quickly respond and contain the virus. The symptoms are generally light. The rash is a sign of immune activity rather than severe illness, and recovery is complete in most cases. It's always best to consult healthcare professionals for personalized advice, but for most children, fifth disease is a temporary, self-limited illness that they recover from without much trouble.